First Class presents a Q&A addressed by the World Health Organization about the recent coronavirus pandemic and how to protect yourself whilst traveling.
Dr. Dolea, thank you very much for being with us first. And people want to be clear, is this airborne virus or it's just droplets?
This is droplets. This is not an airborne virus. The virus is transmitted via droplets from people that are coughing or sneezing and they are at very close contact with somebody. So for the moment, we know that the virus is not an airborne transmission.
Can we get the virus without any contact with infected person?
No. People that are infected, they can transmit the virus. People that are symptomatic, they can transmit the virus. There's no such a thing as a truly asymptomatic person. Even people that may not show immediate symptoms like coughing or sneezing, they still may have some subclinical symptoms like subfever or something. And in those cases, which we're now even studying in the situations where some examples have been mentioned, in those cases it may be possible, but it's not fully asymptomatic person. So the person may have, for somebody to transmit the virus, they have to have some kind of symptoms.
Now, we see lots of people using masks. How effective those masks are?
The masks are very effective for protecting people that are sick from preventing them to shed the virus or to transmit the virus onward. For people that are not sick, masks are not very effective. It's also important to make sure you use the mask properly and to not touch the exterior of the mask, even if you are not sick.
We get a couple of questions on hand hygiene. So, for example, Mahmoud Mohammed Amar is asking, is it enough to wash hands with the tap water or it must be washed with the antiseptic products or alcohol rub? We have another question from Nigeria, from Folorunso Adulamo, saying how many times per day we should wash hands?
You should wash your hands as long as they get into contact with dirt. So for the hands that are dirty, you use soap and water and you wash them properly as for any type of hand hygiene measures. If your hands are not dirty, you can just use alcohol-based rubbing. So it's not a matter of fixed how many days, but as long as it is required for you to keep a proper hand hygiene.
We have John Zedrick asking how many days are the incubation period for this virus?
The maximum incubation date is 14 days, but we've seen studies that show that it can be between 2 and on average 5 days. But the maximum period to be on the safe side is 14 days.
Is cabin environment, plane cabin, dangerous in any way?
No, absolutely not. We know that the virus so far is transmitted via droplets or fomites, which means a close contact with people that are infected and that are shedding viruses. It is possible that the virus can live on surfaces as well, but for a short amount of time. The best thing to do in a cabin is to practice proper hand hygiene, to wash hands properly with soap and water or to use alcohol-based rub, and to use coughing etiquette and to really keep the distance from people that are coughing or having symptoms.
Next question is, what about hotel rooms? People who are traveling, what precautions they should take when being in a hotel rooms during the travel? Being
on travel in a hotel room is similarly an issue of practicing personal protection measures. So it should be careful to wash the hands properly, to use alcohol-based rubbing of the hands. Make sure that the food hygiene practices are also taken into account. And there is no specific requirement for being in a hotel than being in any other place while a traveler. Similar protection for regular people or regular travelers have to be taken for any as if for any other type of respiratory infections, as we mentioned before.
If I was on a flight with someone who was subsequently confirmed as an infected person with a novel coronavirus, what should I do?
As a passenger, and if somebody in your plane has been suspected of having a coronavirus, the passenger crew knows the rules, the procedures, and they would ask all the passengers sitting 2 rows behind or 2 rows ahead of these suspect cases to fill in what they call a personal locator form, which is a form where you provide your contact details in case the authorities need to contact you. If you indeed need to be contacted as if the case turns out to be positive, you would then turn to be a contact of a case, and you would need then to take precautions yourself and monitor yourself for 14 days for symptoms like fever, coughing, shortness of breath, or general fatigue.
Thank you. We have a question from Bien2. How to protect a baby on an airplane, given that baby cannot wear the mask?
The baby should be protected by the parents in the same way that the parents are protecting themselves. So keeping them away from people that may show symptoms, that may cough or sneeze. Try to keep the baby close to the mother or the parents so that he or she doesn't get into contact with suspect people on the plane.
Thank you. Interesting question from Bagong Bayani. He says, since people need to bring alcohol products or sanitizers, can security arrangements of airports be amended to allow passengers to bring more than 100 milliliters on their carry-on bags?
That is the question that we need to discuss with our IATA colleagues. For the moment, the alcohol products are available in small bottles of 100 milliliters, and you don't really need for a long travel more than that. You should be aware of what countries have put in place in terms of restrictions and plan your trips accordingly. And you should make sure that you practice the hygiene and the hand hygiene and the respiratory hygiene as advised by WHO and by your practitioners to practice a proper coughing etiquette, to wash your hands properly, and to really use the similar measures that you use for any type of respiratory disease like influenza, for example, or any other coronaviruses.
A question from Jenny Chung about the panic buying when people are buying toilet papers, pasta, canned food. Why do people behave this way? And what should they do?
Okay. So I said earlier that fear is something that we're all designed to experience fear, because fear is something that can help to keep us safe. And fear is something that we experience in the face of perceived or actual danger, or where there's uncertainty, something unknown, something unclear. So fear can sometimes lead us to take actions which help to keep ourselves safe, and sometimes it can lead us to actions which might not be beneficial for us and might not be beneficial for others. So this is something that fear does. If we're experiencing a lot of fear and engaging in actions which perhaps aren't helpful or necessary for ourselves or indeed for the benefit of our communities, it's something that it makes sense in the context of the situation. But the advice around this is to think about what are the facts at the moment. What does the information say about what you need to do to protect yourself? And I think the advice is around making sure you have sufficient resources should you have to self-isolate, which is for a period of 14 days.
My fear is about coughing in public. People look at you with suspicion. How can I approach or manage a situation like that?
That's a very interesting question as well. I think it's an anxiety that is indeed shared by many people. The important thing here is you don't necessarily need to take responsibility for managing other people's responses to you. I think ultimately, as long as you're following the protection procedures and the coughing etiquette, so on, that's been advocated by WHO, that's what's important in this situation. So other people, I hope you are aware of the advice that WHO has been issuing around how to protect yourself. For example, good coughing etiquette. but it's not something that we cannot always manage the response towards other people. But this is part of why addressing the stigma around COVID-19 is important. It is flu season at the moment. Many people do have coughs and sniffles.
And when we are talking about coughing etiquette, it means coughing to your elbow or cover it with tissue, and then after that to throw it away immediately in a bin, a closed bin.